Okay, well, I think we're ready to get started. Welcome, everyone. My name is Farah Ismail. I'm a manager of community advocacy at Diabetes Canada, and we are excited to deliver today's webinar on diabetes and influenza. We are joined today by pharmacist, certified diabetes educator, and expert speaker, among other things, Daniel Burton. So welcome, and thank you for joining us today, Daniel.
My
Today we'll be answering some key questions around what influenza is, how one living with diabetes may be affected, and how COVID also plays a role in our health and well-being. We'll be taking some questions from our viewers. So for those of you that are joining us on the Zoom profile, please submit your questions through the Q&A box. And for those of you that will be joining us through Facebook Live, please submit your questions through using the comment box. I do want to take a moment to thank you to our sponsor, for Sanofi, for making today's webinar possible. So Daniel, I'll pass it over to you. We can get started.
Awesome. Thank you very much for having me. It's always a pleasure to pass on the knowledge and answer some of the many questions that I often get. So as it's kind of already been alluded to, we'll be really touching on the importance of the influenza vaccine, having diabetes, and now what are we doing with the COVID-19 and currently seeing the increase in the cases and stuff. I always like to highlight here that if you ever have any questions or anything like that or want to reach out, please feel free to use my email there at the start of the presentation here. As well, I'm very active on social media. In fact, every Tuesday I do kind of an Ask Me Tuesday questionnaire on Instagram and Facebook. So if there is questions beyond this or other questions that you might have in terms of diabetes, obesity, please feel free to reach out, and always happy to answer and provide some insight in that respect. Just a few of my quick disclosures here. I do receive some consulting and contracting fees. I've got some grant funding from Canadian Foundation of Pharmacy, and I hold some other positions here in Calgary, as well as some national positions. Sanofi is going to be our sponsor for this presentation here. And today's learning objectives. So what I really want to kind of bring forth is understanding what exactly is influenza or the flu and why it is important in terms of diabetes, looking at kind of an outline in terms of prevention and treatment measures, and then explore where COVID-19 and what that means for diabetes and that sort of thing. So always kind of a good starting point here is just looking at, what is currently the situation around diabetes. And what we know is that it is a growing concern. It is becoming a larger and larger issue and concern from a public health perspective. And certainly the number of people that are living with diabetes and dealing with diabetes on a daily basis is increasing dramatically. And so just for expected to increase, this is kind of in Alberta itself, but also across the country, similar trends and expectations in terms of rises in the number of people that have diabetes. So what is the flu or influenza? Primarily, it is a respiratory infection. There is two main viruses that we look at, A and B, pretty simple to remember. They happen on kind of a seasonal basis, generally from the fall to winter. And then obviously in the Southern Hemisphere, it's opposite of that. But the big way that you can know that you have the flu is that you will know. It's very, very distinct from a cold in the fact that you're not going to feel good. You are going to get knocked down, muscle aches and pains, maybe a cough, fever is going to be likely there as well. Some other potential symptoms and such that you might experience, loss of appetite, fatigue, headache, chills. Children, we may see some GI symptoms in. So if you have any kids that are that catch the flu, you may see some atypical symptoms, but certainly not out of the realm of things. It's just the way that their body processes things, and they're a little bit different in that respect, if you will. The more serious complications may be a severe lung infection that can be pneumonia or possibly death. Again, the big thing is with the flu vaccine is that it can be quite the burden on our healthcare system. So it's always a concern. And that's why there's always such big campaigns, is that we're so worried about the hospitalizations and the number of deaths that are equated to it every single year. Obviously, that's a big strain, not only on our communities and such, but also our healthcare system. common question that I often get is, what is the difference between influenza and the stomach flu? We tend to say I got the flu, but I always like to make this differentiation with my patients in looking at what specifically is the stomach flu. And I'm sure we've all experienced it, whether it's, you're traveling to another country, you catch something like Norwalk, what have you. But the stomach flu is very much GI related. So it's happening in our stomach, it's happening in our intestines, nausea, vomiting, diarrhea. Those are the very prevalent symptoms. And generally with this one, you're also staying home. You're not going to be going out in the public or anything like that. It usually lasts a course of maybe maybe a maximum of 3 days. And then it resolves itself and it kind of goes on. You really generally don't need medical intervention unless you're having, severe diarrhea, vomiting, fever, and leading to things like dehydration. And in some situations, we might be able to treat it with antibiotics, depending on what the underlying cause of the stomach flu is. But for the most part, it kind of runs its course and it's done and over with. And so it's very distinct from the influenza infection that can occur, which is very much based in the respiratory tract. So, our big problem, what are we looking at? What are we concerned in terms of diabetes and influenza? The problem really that we're looking at is that with an individual that has diabetes, they're at a higher risk of complications, in particular, going to the hospital and in worst case scenarios, leading to potential death. Big in part, why this is such a concern is there's often conditions that people with diabetes will have. So, there's maybe kidney issues, blood pressure is a problem, potentially COPD if you have smoked in the past. As well, what we know from the data and the information is that when our blood sugars are not properly regulated, it can actually affect our immune system. It can affect the white blood cells. So whether that's, you probably heard of T cells, B cells, phagocytes, that kind of thing. And those can get kind of thrown off with too much sugar in the system or lack of sugar in the system, and impairs the ability for those cells to essentially fight the infection off. So if you do contract it, it has more of a chance to overwhelm the system and cause those worst complications, such as leading to the pneumonia, the bronchitis, that sort of thing. Interestingly, what we do know is that if you contract the flu and you have diabetes, you actually see an increase in things like heart attacks and strokes, upwards of six times greater than what you have maybe on a day-to-day basis without the flu. And we don't exactly know what the mechanism is there. It's thought to be kind of this increase in inflammation that the influenza vaccine causes. And so it just puts a massive stress on the system. And if you have diabetes, you're already at that increased risk of having a heart attack and stroke. And so the flu can just compound on that and make it that much worse. And for any of you that do have diabetes, I'm sure you've noticed that when you are sick, particularly if you're have a more severe sickness, you will notice that your sugars maybe will go up and down, and there's a few challenges in that sense. So you'll see higher blood sugars, even though you're taking your insulin and your regular medications. Just your blood sugar management just gets increasingly challenging to manage. All right. So the vaccine itself. The development of the vaccine basically starts February-ish, January, February every year. The World Health Organization will put out their recommendation as to what they predict the flu virus is going to look like in the coming year. So they kind of take essentially a stab in the, not a stab in the dark. It is an educated guess, if you will, and it's kind of looking at what has happened in the Southern Hemisphere, Australia and that sort of thing. What kind of viruses are they seeing? And then they make a recommendation around some potential strains that should be included in the flu vaccine so that we can hopefully give the best protection possible. So generally they put up and say, here's 3 strains that we think are going to be circulating and such. And then most companies will actually add in a 4th strain that is unrelated to the other 3 as a kind of maybe a security measure, an extra step, that sort of thing, to try and add a little bit more protection and hopefully to make the vaccine that much more effective. Now, depending on the year and what has happened, sometimes we hit the mark and it's pretty good. Other years, not so much, and it's not overly effective. I will be curious to see what happens this year in terms of the virus, because we did have the lockdown and change in travel patterns and stuff like that. So there may be less mutation. The virus that was around last year was knocked out relatively quickly when we went into lockdown and everyone was having the social distancing precautions. So we might see some differences and that sort of thing. So it's going to be tough to say, but hopefully we did a good job this year. To give you guys a little background as to what happens here in Canada, the National Advisory Committee on Immunization, NACI, we call it, they create the recommendations for Canada, and they really kind of take into account what is our specific population, what has our past experience been, and all of that kind of information, and then really kind of tailor and make specific recommendations for the vaccines that we should have here in Canada. So I'm sure you guys have heard of the flattening the curve concept. It's been all the rage, and certainly something that's becoming more and more concerning as COVID cases go up here. But the flu shot really is important, in particular for people with diabetes, is because influenza and COVID can cause severe complications in individuals that have diabetes or other chronic conditions. So it is something that we want to look at. It really is going to be a proactive measure. You know, COVID, we don't quite have a vaccine yet, but influenza we do. So if this is something that, you know, it's proactive, it's low risk of harm or issues, and we can kind of take, you know, one problem out of the system, then that's definitely what we want to do. And it's to really ensure that we have enough healthcare resources to kind of go around. So if we can mitigate this flu problem and prevent people from being hospitalized or having complications, that's going to allow us to have more of those resources to deal with other issues and problems like the current ongoing COVID situation. So it's more important this year, yes, but this is something that we're always looking at year after year, and you know, the costs and trying to prevent people from ending up in the hospital and that sort of thing. So the individuals that we should be looking at to get the flu vaccine, generally anyone that's over the age of 65, as I've alluded to, chronic diseases, so high blood pressure, diabetes, obesity. That list obviously isn't all encompassing. Basically, if you have a chronic disease of some kind, pretty good chance that a flu vaccine will be good to get for you. Anybody that has autoimmune conditions or any medications or anything that might affect your immune system. So if you've had a transplant, that sort of thing, children, pregnant women, and of course, those that are residing in care homes. So those are really the people that we should be targeting first and foremost. But as well, it is recommended for anybody that is 6 months of age or older. That being kind of the herd immunity concept, that if we can vaccinate enough of the population, hopefully we can prevent the spread to other individuals that might be more at high risk or that can't get the vaccine or that sort of thing. So here's a list of all the vaccines and the various companies that produce them throughout Canada. Obviously, there's quite a bit of overlap, and as well, different provinces are going to provide different levels of coverage. You know, I'm here in Alberta, and I've seen the Afluria and the Flu Zone by Sanofi. It kind of also shows, who's going to get coverage and that sort of thing. So there is a bit of a difference between what is accessible and what you can get a hold of. There is slight differences between some of these vaccines in the sense that some only have 3 strains in them, whereas other have 4. There is a live attenuated, so there is a live vaccine that is available. That's the flu mist or the nasal spray. It's becoming increasingly rare that I do see it, but we use it primarily in children and kids just because it's a little bit easier to administer. There are other risks and stuff that come with it, and certainly it needs to have a conversation with your healthcare provider if it is something that would be maybe more beneficial for you or not. But primarily, you're looking at the standard vaccine doses that are available across the country, and essentially all your various healthcare providers will and should have access to these ones. So how effective is the influenza vaccine? It's always a question that comes up. And I mean, we've all had that friend that got the vaccine or even yourself and still got the flu. So previous years, when we nail it pretty good in terms of matching and our guess is a good guess as to what actually is going to be circulating in the community, we have about a 40 to 60% effectiveness. So kind of to put that into kind of some terms to comprehend, if there is 10 people that get the vaccine, 6 of them, 4 to 6 of them hopefully won't actually contract influenza, but the other 4 of them might contract it. So it does significantly reduce that risk, going from say 100% to, maybe 4 people, maybe 6 people at most. Again, that's depending on how well our guess and how effective it is. What we do know is that if you do end up still contracting the virus after you've had the flu vaccine, your symptoms are likely going to be milder. So you won't have them as severe. You might not be as bedridden. Still need to stay home and follow all those kind of precautions and measures, but you might be able to get through it a little bit more easily. Um, and kind of a point here is that there's some interesting data coming out that if we get the flu shot every single year, we see that it may have additional protection. So it might actually kind of have a compounding effect in terms of every virus that you get exposed to year after year has a protective effect and actually helps to prevent future infections and that sort of thing. So it may have an additive effect, and definitely why it's recommended to get the flu shot every year is that you might get that additional protection. Other preventative measures. So prevention is always the best course of action. If you can not get it at all, that is absolutely the best case scenario. A lot of the same things that we all should be doing with regards to COVID, but again, just to reiterate them here: washing your hands, avoiding anybody that might be sick, stay home if you're sick, or if you have employees or whatever, tell them to stay home and take the time off. Covering your mouth and nose, making sure you're disinfecting surfaces, and do what you can not to touch your face. I know in the healthcare setting and stuff like that, it is unbelievable how much you want to touch your face and how often you touch your face throughout the day. So I know that's increasingly challenging. As also with regards to the outside of your mask, don't touch the outside of your mask and then touch your face. Wash your hands in between, because the outside of your mask has all those potential contaminations on them as well. So lots of things around that and lots of things to think about, but doing the best that you can. And these are going to be your best bet for preventing contracting the influenza virus. What if you do get the flu? What do we do? How do we mitigate it? So again, staying home, avoid others. Right now it's kind of with COVID, it's the self-isolation, including from your family members and stuff. Not necessarily a bad thing to do in terms of the flu as well. Continue to practice the other proper hand hygiene and other healthy behaviors. In terms of the virus and getting it, again, it's kind of one of these things that'll tend to run its course. We get it, we deal with it, and then it goes away. If you have a more severe case, or if you have more of a high risk individual, such as staying in a care home, greater than 65, talking with your doctor, that sort of thing, there is antiviral medication such as Tamiflu. Doesn't necessarily cure the virus, but can shorten the duration of symptoms that you might have. So it might, you might be down and out for a week, but it might lessen it to 5 days, for example. So certainly something that can be looked at as additional treatment. The only thing with a lot of these antivirals is that you need to catch it early on. If you're all of a sudden at day 5 and then you go to the doctor and get the Tamiflu, probably not going to be that effective. But if it's day 1 or 2, then it might have that better effect and response. In terms of aches, pains, fever, that sort of thing, very much symptom management using things like ibuprofen or Tylenol. Again, that's going to be specific to you. So be sure to talk to your healthcare provider to kind of get the best recommendations for you, your health, and your medications. Some special considerations for people that do have diabetes. I'm sure some of you have, have had sick day management, or hopefully have had a healthcare provider kind of go over this stuff with you. But things that we want to look at, and as I've already alluded to, that when we get an infection, our blood sugars become harder to control. So we want to test a little bit more frequently, making it every 4 hours if possible, or at least a couple more times through the day, making sure you're still getting plenty of fluids. It's always kind of that old adage that drink fluids and that sort of thing. If you can, try to eat normally. We always don't feel like it, but trying to consume your normal meals and portions, that sort of thing. If you're unable to, ensuring that you have quick acting sugar available and more closely monitor those blood sugars, as well as looking at things like electrolyte replacements if there's any kind of GI symptoms in particular. Um, if you're struggling with food or your blood sugars are on the higher side, that sort of thing, and particularly if you have type 1 diabetes, considering testing for ketones, keeping an eye on that because that can be an indication of diabetic ketoacidosis, which can be very serious. So, keeping an eye on that respect. In the interim, initially, anyways, continue to take your insulin and other diabetes medications. In particular, if you are having no issues with food, if you can eat and that sort of thing, continue with those medications. If after 24 hours you're finding, I can't eat, I can't get anything down, then there is certain medications that we certainly want to stop. And I'll kind of touch on those briefly on the other side. Again, for you and your specific medications and health conditions, talking to your pharmacist, doctor, nurse, whoever's your educator, that sort of thing, to make sure that you go over and ensure you understand which medications and what you should do in your given situation if you do, say, get the flu, for example. Here's kind of an overview of some of the medications that are recommended to stop. We use the SADMANS acronym, and you might not necessarily know the drug class like sulfonylureas. That's going to be things like gliclazide, that sort of thing. I won't necessarily go through all the various drugs that are there because there can be a lot of them in each class. But again, talking with your specific healthcare provider, and they can review your own individual meds and give you a little bit more detailed information and which ones you should stop and which ones you should continue to take. Common misconceptions. I always like to touch on this because this is a lot of questions that I get, and is some of the stuff that might float on social media. So hopefully can kind of debunk a few things here. Allergy to eggs. The vaccines are still essentially developed and created and grown up in an egg ovum albumin kind of thing. There's something scientists at a benchtop do, and they're much smarter than me, and they create it to make it all happen. If you have an allergy to eggs, it's not really a concern anymore because they have removed so much of the egg proteins and that sort of thing that, yeah, if you have an allergy to eggs, you can still get the flu vaccine. There's no problem with that. The flu vaccine can cause the flu. No, it cannot. I always say that it can cause flu-like symptoms the following day. And what those flu-like symptoms are is just your body ramping up an immune response. If you do experience anything, it's going to be very mild, maybe a runny nose, maybe a sore throat. Just be mindful of that, but it will not be the full-blown flu. You will know that you have the flu or not. If you happen to get the flu vaccine and then get the flu a few days later, that's going to be just more of a coincidence in that sense. It does take about 2 weeks for your body to develop a full immune response to the vaccine. So it's very well possible that you could have contracted the flu sometime in that time period. It isn't the vaccine itself causing the flu. I had the stomach bug after getting the flu shot. Again, as I kind of alluded to, the stomach flu and the influenza virus, very, very different. So it doesn't protect against stomach bugs like Norwalk or other kind of intestinal and stomach viruses or bacteria. It only protects against these ones that the influenza virus that infects our lungs, ear, nose, and throat, and that sort of thing. And then kind of the final one here, the flu vaccine is harmful. We have a lot of really good data to show that it is very safe, and there isn't a series of clinical trials that are done to confirm that the virus doesn't cause issues or problems each year. So it is safe. It is no problems or concerns. The main common complaint that I hear of is maybe a sore shoulder where the vaccine was done. A quick note on the high dose influenza vaccine here. Provinces will only cover it if you're, you can kind of see at the bottom there, Ontario and Prince Edward Island will cover it for all adults that are 65 years of age or older. And other provinces will cover it for those that are 65 years and older and living in long-term care. Other than that, if you want the vaccine and you fall out of those, you generally have to pay out of pocket for it, which might be beneficial. I don't know the cost of that exactly, but it's certainly something that you could look into if you wanted further protection. The idea behind the high dose vaccine is, to provide an additional level of protection against the virus, give you a more robust immune response, if you will. So ramps it up a little bit, and it might have better chance of reducing risk of complications, in particular in those that are greater than 65, in reducing things like hospitalizations compared to those that just got a standard dose vaccine. Safety wise, yeah, there was really no concerns. It was pretty comparable to the standard dose vaccine. So certainly something to consider if you're at a higher risk. It may provide you a little bit better protection, but that's going to be something on an individual basis. If you fall into the categories based on your province, certainly something that can be looked at and certainly something that can be given. So now COVID-19, the big question of where we're at, what does it mean? What do we got to be thinking about moving forward from here? So just wanted to give you guys a quick comparison of things here, just because the COVID-19 infection, a cold, and influenza, as you can see, there's a lot of commonalities between them. In fact, if a patient presented to my office and trying to differentiate between COVID-19 and influenza would likely be very challenging, short of if you have the loss of taste and smell. That kind of seems to be a very unique symptom and increasingly common with the COVID-19 virus. But again, would be very difficult to kind of differentiate the two, just because some of those other side effects that are, or symptoms that do arise with COVID-19 are certainly more rare. It would be pretty easy, I think, to differentiate it from a cold. In terms of COVID-19 and influenza, like I said, is probably going to knock you down. A cold, generally, most of us are able to get through it and go to work. However, now, obviously, with screening and stuff like that, we should still be staying home if we do contract a cold, but doing the best that we can in that respect of things. So this is just kind of a comparison of some of the symptoms. And, if you do contract or you start feeling sick, maybe you can kind of get a better idea of what might be going on in respect in between these three. So the big question that I've had a lot is, should I still get the vaccine? We're trying to socially distance. What is the deal? Why is it important, et cetera? Again, as I already alluded to, we really want to reduce the burden on the healthcare system. We have a vaccine for the influenza virus. So if we can take care of that problem and, focus more attention on the COVID-19 problem, then that's going to be certainly something we want to look at. Again, priority given to the high risk populations, as well as care providers, the people that are working in the hospitals and the care homes. They're going to be the ones that are going to transmit it from person to person, floor to floor, that sort of thing. So we need to focus on them and ensuring that they're getting the vaccine to help protect others and prevent the spread of influenza. And our big focus is, still getting it, still going to a clinic, pharmacy, physician's office, what have you, but just making sure you're following all the protocols and procedures and staying as safe as possible. Some final notes. I've gotten a lot of questions about this recently. Pfizer recently put out a press release about the effectiveness of their vaccine. This, of course, with everything that's going on currently in the States and stuff, highly politicized kind of event as to what's going to happen with it. But their initial data is showing that it's 90% effective. So this is kind of just some numbers that I borrowed from a colleague of mine. But essentially what we're kind of saying is that people that got a placebo vaccine, so placebo, they got an injection that didn't have anything in it. Basically what we're seeing is that 1 in about 250 people are still contracting the COVID virus, whereas those that got the vaccine, it's about 1 in 2,500 people contract the COVID virus. So it does look like it is providing a good level of protection. There's still a lot of unknowns in that regard, though. They didn't release any of the safety data. What exactly are they considering effective? If the 1 in 2,500 people, are they still ending up in hospital? What exactly is their populations? Still a lot of questions and a lot more data needs to be collected, but I would say we're getting closer to a vaccine. However, it's all great that we have the clinical trials and stuff. It doesn't mean they've started manufacturing and production or anything like that. And that's going to be the biggest challenging, is ramping this up to a large scale, and then distribution, getting it out to the millions and billions of people across the globe to potentially get it out to them. And then, the COVID virus we've also seen can mutate itself and do different things like that. So there's a lot of other hurdles and stuff that we need to get through, but I'm predicting about 12 to 18 months. Some people are saying 6 months, but I'm going to hedge my bets and say it's still going to be a long time before we see a vaccine fully get out and have access to it on a regular basis. So final wrapping up points here. Yeah, patients with diabetes are at risk of a higher complications. And so we definitely want to prevent and yeah, hopefully not contract it. Prevention is the best key versus trying to treat it after you contract the influenza virus. You should still try and get it if you're able to in your community. If you haven't yet, I know a lot of people have been doing a good job of getting on top of that, but definitely get out there and get your virus regardless of the COVID pandemic. And as I've said, prevention is really the best solution. So that's pretty much it on my side of things. Happy to answer any questions, concerns, thoughts, or anything like that.
First say thank you so much for joining us today, Daniel. This has been a very educating experience on influenza, the importance and value of protection and prevention and getting the vaccine, as well as how COVID plays into everything, because I know there's been a lot of questions that have come to Diabetes Canada about this. So being able to talk about this on this webinar has been very helpful. Thank you so much for that. As Daniel's mentioned, we're going to open it up to questions. So I see that there have been a couple questions that have come in through Zoom. I do want to remind everyone on Facebook, please feel free to put your questions into the comment box. And we did get actually a couple questions prior to the webinar. So I'm going to start us off with those at the moment. Does a universal flu vaccine exist? And if not, how long based on your expertise, do you think we are? How far away are we from something like that?
I know they're actively working on it. I mean, it's always the big talk in the scientific circles of where are we at in terms of a universal vaccine. I honestly, I don't know enough of the data to truly say where we're at with it. I think once again, we're getting closer, but influenza is a tricky virus because it mutates so easily and changes so easily year to year. But I think with science and technology, and I think definitely with as bad as the COVID situation has been, I think we've got a lot of learnings and information that are going to be taken away from it that will hopefully possibly streamline and speed up the process to get a universal flu vaccine. But I suspect it's still going to be a little bit of time before we see that that data really come to light.
Great, thanks for that. And folks are wanting to know, other than their family doctors, where can they go to get their flu shots?
Definitely. Well, the main places that I've heard of and that I've been giving injections as a pharmacist is in the pharmacy. This has been one of the top areas. I think the recent stats from Alberta is that pharmacists have given about 88% of all the influenza vaccines thus far this year. There is some public health clinics, but again, those are, if they're being run by nurses and such like that. They're a little bit more fewer and far between just with the COVID pandemic and such. I have been finding, again, pharmacies are the best equipped, but there is a lot of doctors out there that, they're trying to catch people. Since you're here, let's do this kind of thing. So if you go in for another problem or for a refill of prescriptions or what have you, if they have some vaccine available, they're trying to gather those people. So it's kind of one less trip out into the public sphere and particularly interacting in where people might be sick and stuff. So pharmacies, I would say family physicians' offices, and if there is a public health clinic available to you, that would be the other best place to go.
A couple of our participants have noticed in their areas that there is often quite a few lineups and sometimes even shortages of the flu shots. So any idea of what may be being done right now to kind of help combat that?
Yes. So it is becoming an increasingly worrisome issue. I mean, like I said, they started kind of the flu vaccine process back in February. And so a lot of the information and how much we should manufacture and that kind of thing was based on previous years. And we've never had COVID and the concerns around that. And this year, we're obviously seeing a massive influx of the number of people that want to get the vaccine and such. Unfortunately, from what I understand, the manufacturers and stuff like that, they've manufactured their lot, and I don't think they're going to, go back and start manufacturing more vaccines. So it's a matter of just distributing what we do have available, and what the Canadian government and such, purchased from the company, spreading that out across the province as evenly as possible and trying to increase that. I know we've had a initial delivery and it has come out to a number of pharmacies and clinics and that sort of thing. And now we're kind of waiting for a second delivery. Some places are starting to get it. I know places like Manitoba are really struggling. They had delays at the start and now, they finally got some. And now I think there's the shortage issue. So it's really variable place to place. And from what I understand, pharmacies, physicians, clinics, and that sort of thing are all really doing their best to make sure that we kind of get an even distribution so that we can provide coverage to our various populations. Again, as things become shorted and such like that, it's going to be more the focus of getting our high risk population. So those that have chronic diseases, those living in care homes, we're essentially going to delegate to those that need that greater level of protection. But we still want to keep that in mind that, yeah, we want to try and target anybody that's 6 months of age and older.
We have a particular individual who is actually above the age of 65, high risk, living with diabetes, and interested in getting the high dose vaccine, and has been turned away from their family physician, who's noted that the vaccine should be recommended, or rather is recommended, for those over the age of 84. And I know that's kind of contrary to some of the best practices you mentioned earlier. So any support or advice you can give to them, or maybe perhaps would we recommend them to go elsewhere to get the high dose vaccine?
Yeah, 84 is an odd age to kind of make that recommendation around. As far as I know, there's really no scientific reason for it. And I would say that was more based maybe on the clinic's own guidelines themselves, not so much what the National Health Committee Advisory Board kind of says. I would look into other places, either a pharmacy. I know pharmacies definitely can order in the high dose. They may not carry it that day, but certainly can order it in. And again, if you're in a province where maybe it's only covered for those that are 65 years and older and in a long-term care home, you may have to pay out of pocket for it if you're a community dwelling individual. But if you're in one of those provinces that offers it to those that are higher, greater than 65, certainly you should be able to get access to it and be able to get that high dose influenza vaccine. I would just call around and try to find some other places that offer it. There really shouldn't be a restriction in that sense, restriction on either. Yeah, if you want to pay out of pocket for it, I mean, absolutely, or vice versa. If you are qualified for it and are being denied it, that shouldn't be the case.
Great, thank you for that clarification. We do have one last question, which I'll take. Something that you had mentioned earlier when you were speaking to the differences of influenza and the stomach flu. So this individual is just wondering what other symptoms they may experience if they have the stomach flu, other than stomach pain. If you could just reiterate that, please.
Yeah, so pretty much, the stomach flu is really going to be anything that's going to be along the gastrointestinal tract, so your stomach and intestines. So you can kind of think of it along essentially that pipeline, if you will, right? Goes from our mouth and out to the other end. So the primary symptoms are going to be stomach cramps and pains. You may experience a fever, nausea, vomiting, diarrhea, other GI cramping, gas, that sort of thing are certainly all in the realm of possibilities. Some people might experience some muscle aches and pains as well. So that kind of has that overlap with influenza. But again, is that necessarily the stomach flu itself, or is it more maybe associated with the dehydration that can occur when you're vomiting and have diarrhea and such? So that's with the stomach flu. It's very important to make sure you're doing your best to stay as hydrated as possible. Electrolyte solutions like Hydrolyte, even Gatorade. I prefer G2 for my patients that have diabetes because it doesn't have as much sugar in it. And being mindful of that and doing what you can to get some food into you. I know it can be challenging, and yeah, really focusing on that respect of it.
Great. Thank you so much, Daniel. And folks, that does conclude today's webinar. I do want to sincerely thank Daniel for, again, educating us and being available to answer questions. He did provide his contact information earlier on. So feel free to reach out to us at Diabetes Canada, or as well reach out to Daniel. I want to reiterate my thanks to Sanofi for helping support today's webinar and making it possible to get this information out to you folks. And I do want to remind everyone to come and visit us on our social media pages and to come visit us at Diabetes Canada website. We have lots of up-to-date webinars that are coming in the next few weeks on different topics supporting you in diabetes care and management. So we look forward to your participation in the future. Thanks again, everyone, and thanks for being with us today. Have a great day.